Hi, I'm Lori Wolf, and I'll be talking to you today about a great opportunity for Salesforce with a newly designed healthcare mobile app. This application is our innovative idea to help people with their medical needs. We are developing a single mobile app that will provide access to virtual medical staff, allow users to securely store medical records, as well as give preventative healthcare, medication, and medical appointment reminders, and will allow users to search for best priced health insurance coverage. The first step of our process was to determine unacceptable moments of struggle. When it came to a person visiting their doctor, we found multiple moments of struggle. Our original idea was that people needed proper healthcare education, but this idea quickly evolved because there are many different reasons that people don't want to go to the doctor. Some people may be in denial about the seriousness of their condition and refuse to inconvenience themselves with a doctor's visit. Others just fear going to the doctor, or they find it inconvenient, or they feel they lose precious time at home or work where they could be spending time with family or making money. People with high deductible insurance policies or those with no healthcare insurance whatsoever may not want to shell out big bucks going to the doctor for what may be a trivial matter. Others with chronic conditions may not want to visit a doctor every time a problem arises. Lastly, the recent COVID-19 pandemic has created a boom of virtual meetings, so we found that the best way to make our solution more valuable was to add a telehealth service element to it. When our work was rated by reviewers, we found that 78% of the reviewers rated our moment of struggle as a 4 or a 5 out of 5. This is known as the top 2 box score, showing that the moment of struggle was real. Originally, we thought our solution could best serve lower and middle class families that would most likely not be able to take time off of work to visit a doctor because the result would be a lost time at work or other places where they are needed. Our idea has changed since drafting our original value proposition canvas, but our solution still plans to help by treating medical problems before they get worse, diagnosing medical problems, providing medical treatment, providing patients with healthcare status updates, and providing a preventative healthcare schedule. These gains or success outcomes for the customer will occur because of our on-demand virtual medical staff and preventative healthcare schedule provided by our healthcare providers. We found many pains endured by the customers, including medical staff that is too busy to talk in depth, missing work, and losing pay for doctor's visits, wasting money at the doctor's office when there may be no medical problem at all, and not being able to get the time off of work or securing transportation to the doctor's office, and paying too high of a deductible or copay. These pains, also known as job activities that require too much time, energy, or effort, can be fixed by our solution because we will have virtual medical staff waiting to help our customers at a lower price. And since it is virtual, no transportation is required. Better yet, it can even be accomplished on a lunch break. Medical staff will be trained to provide the best communication to ensure customers keep coming back and keep ratings high. Our value proposition canvas received a 91% top 2 box score. The next step involved creating a business model canvas. I will now go over the sections of the canvas. When it comes to our channels, Salesforce has a choice between direct or indirect. Although Salesforce will promote its services at events already in place, we found that it will be cost efficient to use our partners for our marketing efforts. Our partners, in turn, will save money with our services. Our customer relationships will mainly be self-service on the application, but when a virtual appointment is required, it will be one-on-one interaction between the customer and the provider. Our key resources will be Salesforce's previous innovation, the Health Cloud, as well as Salesforce cybersecurity team and Tableau, which is now owned by Salesforce. Our key activities are on-demand access to medical staff, medication and appointment reminders, medical record storage, and an easy-to-use application interface. For our key partners, we plan to use government and private health insurance partners to provide healthcare information and to market our services as a cheaper and trusted solution. We will also be looking to contract with telehealth companies. Our service will be available to download on app stores like the Apple App Store and Google Play. For our customer segment, we have found that our solution can be marketed to the mass population because so many people have limited income and busy schedules. Our service will be very useful to those who have chronic conditions, no insurance, or high deductible insurance because our services are cheaper and more convenient than in-person medical appointments. Our cost structure will be lower since Salesforce already excels in data storage, but we will need to pay to store customers' app information. We will have fixed expenses that will be lowered by using a small space in a facility already used by Salesforce. We will also have contract expenses for telehealth services. We plan to incur very little marketing costs because of the marketing efforts by our partners. For our revenue streams, our app will be free to use, but customers will pay for every virtual visit. They will also view ads to provide us with ad revenue. We also plan to have health insurance advertisement revenue from our health insurance policy comparison tab. Additionally, we will offer a premium service where customers will pay a monthly fee for unlimited virtual visits. This helps people with no insurance, chronic issues, and high deductibles. Our top 2 box score on our business canvas model was 80%. Our customer segments include low-income and lower middle-class individuals and families with busy schedules. These customers are needing health care that works with their schedule because skipping work is a financial strain in and of itself. Additionally, insurance companies will be a target as this can provide tremendous cost savings when it comes to users with chronic health issues, as our service is significantly less expensive than a physical doctor's office or urgent care visit. There are a few next best solutions we have identified. First, there is multi-profile medical records, which is a highly rated app and allows a person to track their medical history as well as their family's medical history. The user can store all information related to their medical appointments as well as their doctor's recommendations, which is important if a patient forgets what they are supposed to do. Users can also input when they have taken their medication and their medication schedule. These apps do not offer tailored healthcare information or reminders about upcoming necessities like immunizations or routine checkups, however, which is an important benefit with our app. Next, there is And 7, your personal health record. This app can be used by patients or doctors and has a rating which is not quite as high. Although some people enjoy this app, there are complaints that it runs slow on Android phones, it's too complicated, and inputting information is a pain. When Salesforce enters the market, we expect to be a new dominant design giving rise to a new S-curve for the new value platform. Our design will likely be imitated when it catches on. Because the model is not difficult to imitate, we will follow a disruptive innovation trajectory. Salesforce has the opportunity with this project to capitalize on resources already in the company's possession. The project can tap into idle resources, including human with development labor and capital with servers with capacity. Additionally, hidden resources are likely to emerge with the relationships built with partners and the knowledge and creativity Salesforce staff possesses. These advantages again make the project perfect for Salesforce. Here is a mock prototype of the app including the login and user profile. The user will first be prompted by the app to log in to their account. Doing so will allow the user to view the homepage. The app is intended to be as intuitive as possible, giving the best customer experience possible. The app will have several key features, including access to their medical history, along with any linked family members in the user's care. Users will be able to video chat with medical staff directly through the app. Additionally, a chat bot will be available for any help needed along the way. Utilizing Sawtooth survey capabilities, our team was able to design a survey to assess the importance of the specific attributes of our proposed mobile app. The attributes included tailored healthcare information, preventative care reminders, virtual medical appointments, treatment of medical records, and price. Of these 5 attributes, respondents valued the feature of virtual medical appointments and priced highest relative to the others. In order to get a large and broad range of survey respondents, we utilized Amazon's Mechanical Turk. This platform allowed us to quickly receive survey answers. Once we analyzed the data from our first survey, we had additional evidence that our innovation had differential value and would be preferred to other solutions. This gave us the green light to begin estimating our revenues, cost, and ultimately profit. We expect our revenues to come from the following types of customers: mass population, family plans, users with chronic health issues, users with high deductible plans, and insurance providers. We have created our revenue model strategically in order to maximize customer perceived value for each type of customer. For the mass population, we have a freemium option where we will charge no subscription fees, but expect that users will utilize the virtual medical services at a higher per usage fee. Additionally, we expect to capture ad revenue from this demographic using the app. Similarly, we will partner with insurance providers in order to have these companies push the servers out to their subscribers. In the first year, we will plan to target the subscribers of one insurance provider, resulting in an estimated 50,000 customers from this conquest. For families, users with chronic health issues, and users with high deductible plans, we will offer a subscription service properly tailored to expected usage. For all users, we expect to collect ad revenue. Our team used target costing in order to keep the project profitable. Our main costs will come from our contract with our chosen telehealth provider. Others include payment fees, inside staff, and data storage. We have structured our contract with our telehealth provider at 65% of service and subscription revenue. This allows us to profitably scale the product with ease. Next, we are assuming 3% for customer payment and credit card fees. We expect to need a small team of internal employees, including a project manager, a software engineer, a computer programmer, an application developer, and a marketing analyst. We expect the marketing analyst to be a shared resource at a quarter time dedicated to this project. We will expect a facilities charge allocated to the project and have allowed for a buffer for any contingencies which may arise. With these revenue and cost assumptions, I am pleased to share that this project offers a 25% margin. We intend to use several carefully selected marketing channels in order to best target our key demographics. First, we will work with government agencies to display signage for our apps on buses and subways, as well as in hospitals and clinics. We will work with both Google Play and the Apple App Store to ensure our app is easily accessible to anyone searching for it, or for an app geared towards medical assistance. Similarly, we will use strategic keywords with search engines to ensure those searching the web for services our app can provide can easily find us. Finally, we will use a viral promo offering a coupon for sharing of a link to our app on a customer's social media page. When determining our business ecosystem blueprint, we found that our preliminary work should help mitigate many risks. These risks include resources for our solution using Salesforce cybersecurity team, using a virtual medical services contractor, and having our partners provide marketing efforts. Since our solution will help cut costs for our partners, we foresee no risk in using their resources for marketing. Since no system can be 100% safe, we have had to assume a moderate risk for cybersecurity of our solution that keeps customers' information safe. The Salesforce cybersecurity team plans to monitor the application constantly to ensure no hacks or misuse of information. We also foresee that our solution may be more popular than predicted, and we are aware that our virtual medical services contractor may not be prepared for a drastic change in demand. We plan to fix this by shopping around and ensuring that our contractor has a proper system in place. We also may have a secondary contractor that can take over if the first contractor fails to do the job properly. The moderate risks just described affect our intermediary 2 phase, where customers actively use our solution on their phones. If we can reduce these risks as described, it should reduce the risk of this phase. This brings me to our value price cost framework. We determined perceived economic value from the customer perspective when we ran the mTurk simulator comparing our virtual solution to the competing solutions of CVS Minute Clinic and MedExpress Urgent Care. Our survey respondents found more utility value in the features of our product compared to the features of the next best solutions. Attributes that customers found more utility value in include price, medical history record storage, medical appointments, medication and medical appointment reminders, and preventative care reminders. These attributes will help create a better job solution fit than the solution in use, resulting in differential value for our solution. This differential value converts to perceived customer surplus value. In other words, customers evaluate competing solutions based on the perceived economic value weighted against the selling price. From a value price perspective, we estimate that there is a $59 customer surplus value for our solution compared to MedExpress at $21 and CVS at $16. We determined this customer's willingness to pay to be $129 because even when we priced our solution in the mTurk simulation at $129 and competing solutions at $70, the simulator still shows that our solution is preferred. This in turn suggests that our solution is the best value solution. Price minus cost is basically the profit from each transaction. From a price cost perspective, we estimate a producer value surplus of $21. We determine this with our cost assumptions of our contract with a virtual medical care company at 65% of virtual visit and subscription revenue. Because our total value surplus is so high, specifically with the customer value surplus at $59, this provides us with a pricing flexibility, which in turn increases our best value positioning options. Clearly, this is a terrific opportunity for Salesforce, as this project has proven differential value, leading to proven profit potential. Additionally, due to the nature of this project, this is a great way for Salesforce to grow its social capital. Because of this, we are now asking for the green light to move our solution into the execution phase and begin helping our customers live better, healthier lives.